In this video, we will talk about the hidden dangers of avocados. Despite their health benefits, this superfood can be harmful under certain health conditions. You might be in the risk group. Let's figure it out together. Let's start with point number 1, migraine. Avocado is one of the natural foods containing relatively high levels of tyramine, a natural compound associated with triggering migraines in sensitive individuals. According to research, including a publication in the journal Neosat RS in 2018, tyramine can provoke migraines by affecting serotonin levels and causing the constriction and then dilation of blood vessels. People with migraine sensitivity may experience more frequent or severe episodes after consuming tyramine-rich foods like avocados, aged cheeses, and processed meats. Additionally, the presence of histamine in avocados increases the risk. Histamine can trigger migraines by promoting inflammation and affecting vascular dilation. A 2023 review in the Journal of Clinical Medicine examines the role of dietary histamine in migraine development, recommending that individuals prone to migraines moderately consume histamine-rich foods like avocados. Understanding your own triggers is crucial since migraine sensitivity is highly individual. Keeping a food diary and tracking symptoms in relation to diet can help identify whether avocados worsen your condition. For those who recognize avocado as a trigger, limiting consumption may help reduce the frequency and severity of migraine episodes. Next is point number 2, gallbladder issues. If you have gallbladder problems such as gallstones or cholecystitis, it's usually recommended to monitor your intake of fatty foods, including avocados. This is because fatty foods stimulate bile release, which is necessary for fat digestion. If the gallbladder is not functioning properly, this can worsen symptoms such as pain, nausea, and vomiting. While avocados are valued for their healthy fat content, these fats still require bile for digestion, which may aggravate symptoms in people with gallbladder disease. A study published in the Cochrane Database of Systematic Reviews in 2017 reviewed dietary guidelines for individuals with gallbladder disorders and emphasized the importance of a low-fat diet to prevent symptomatic episodes. These findings confirm that even healthy fats found in avocados may need to be consumed with caution by individuals with gallbladder issues to avoid discomfort and complications. Therefore, if you have gallbladder disease, it's essential to tailor your diet based on your body's individual response to different types of fats. It is always recommended to consult a doctor for personalized advice. Next is point number 3, pancreatitis. People with pancreatitis are often advised to follow a low-fat diet to avoid worsening the condition. Avocados, though rich in healthy fats, are still a high-fat food that can strain the pancreas, especially during inflammation or when the organ's function is compromised. This aspect is particularly important because consuming fatty foods can raise pancreatic enzyme levels, leading to pain and increased inflammation in patients with pancreatitis. A study published in the journal Nutrition and Clinical Practice in 2019 examined the impact of diet on the course of pancreatitis and showed that a high-fat diet could provoke acute attacks in predisposed individuals. This highlights the importance of fat intake control in patients with chronic pancreatitis to avoid worsening symptoms. These recommendations align with general dietary guidelines for pancreatitis, which advise limiting fatty foods to effectively manage the condition and prevent flare-ups. Next is point number 4, oral allergy syndrome. If you have oral allergy syndrome, OAS, it is recommended to be cautious with certain foods, including avocados. OAS causes allergic reactions in the mouth and throat, usually manifesting as itching, tingling, or swelling of the lips, tongue, and throat shortly after consuming raw fruits or vegetables. This condition is associated with cross-reactivity between pollen and proteins in food. Avocado, in particular, is known for its cross-reaction with latex fruit syndrome. This connection was described in a study published in the journal Molecular Immunology in 2011, which presented cross-reactivity profiles of various foods, including avocado, in patients with latex allergies. The study highlights the risk avocados pose to people sensitive to this cross-reaction and notes that individuals with OAS linked to latex may experience similar symptoms when consuming avocados. Point number 5, salicylate sensitivity. People with salicylate sensitivity may need to be cautious when consuming avocados. Salicylates are natural chemicals found in many fruits, vegetables, and other plant-based products, including avocados. They can cause adverse reactions in sensitive individuals. Symptoms of salicylate sensitivity may include headaches, skin rashes, asthma, and gastrointestinal issues. As part of recent research, a 2017 review published in the Journal of Food Composition and Analysis emphasized the impact of dietary salicylates on sensitive individuals. The review stated that dietary management, including the avoidance of foods high in salicylates such as avocados, may significantly relieve symptoms in those diagnosed with sensitivity. The study highlights the importance of an individualized dietary approach to effectively control adverse reactions. Given this information, if a person has been diagnosed with salicylate sensitivity, it may be helpful to limit or eliminate avocados to monitor potential symptom improvement. Point number 6, oxalate sensitivity. For people with oxalate sensitivity, it is important to carefully monitor oxalate intake, as high levels may contribute to the formation of kidney stones and other health issues. Foods high in oxalates, such as spinach, beets, and almonds, are typically excluded from the diet in this condition. Avocados contain a moderate amount of oxalates and may also need to be limited to avoid exacerbating symptoms or worsening kidney conditions. A study published in the journal Foods in 2023 examined oxalate content in avocados and showed that levels vary depending on the part of the fruit and its ripeness. This variability suggests that while avocados are not among the highest oxalate-containing foods, they still pose a certain risk to those who must strictly control their intake. This information underscores the importance of paying attention not only to well-known high oxalate foods, but also to others like avocados, which are often overlooked. People with oxalate sensitivity should discuss their diet with a doctor to develop a nutrition plan that takes into account the oxalate content in various foods. Point 7, liver problems. Concerns about avocado and liver health are mainly related to the presence of certain natural compounds in the fruit, specifically estragol and anethole. Animal studies have shown that these compounds may have hepatotoxic effects when consumed in large quantities. For example, a study published in the journal Evidence-Based Complementary and Alternative Medicine showed that these compounds, when isolated and concentrated, can cause liver damage in certain animal species, such as mice and rats. However, it is important to note that such studies usually use much higher doses of these compounds than what a person receives through regular food. For people with pre-existing liver conditions, such as cirrhosis or hepatitis, there is reason to believe that even ordinary amounts of these substances may pose a risk. A weakened liver's ability to process toxins may enhance the effects of these compounds and increase the risk of further liver damage. Therefore, people with liver diseases may benefit from limiting or avoiding avocado consumption as a precautionary measure to minimize possible negative effects on the liver. Although there are few direct human studies, the potential risk identified in animal studies and the critical role of the liver in detoxification and metabolism suggest the need for caution. Since the body's reaction to food is individual, it is always recommended to consult a physician regarding diet. This will allow for informed decisions based on a person's specific health condition. Point 8, FODMAP sensitivity. For people with sensitivity to FODMAP carbohydrates, managing symptoms often involves avoiding foods high in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These short-chain carbohydrates are poorly absorbed in the small intestine and can cause significant digestive issues in sensitive individuals. Avocado is considered a high FODMAP food because it contains an excess of sorbitol, a type of sugar alcohol classified as a polyol. Consuming foods high in polyols, such as sorbitol, can cause symptoms like bloating, gas, abdominal pain, and irregular bowel movements, especially in people with irritable bowel syndrome, IBS. This is supported by a 2016 study published in the journal Gastroenterologia Hepia, which examined the impact of a low FODMAP diet on reducing IBS symptoms. It emphasized the need to limit foods like avocado in people with FODMAP sensitivity to effectively manage their condition. Such a diet is specifically aimed at reducing the intake of foods that may worsen symptoms and provides a clearer path to improving digestion through dietary adjustments. Point 9, hypotension. People diagnosed with hypotension, that is, low blood pressure, should be cautious when adding avocado to their diet due to the high potassium content in this fruit. Potassium can further lower blood pressure, which is beneficial for those with hypertension, but dangerous for individuals whose blood pressure is already low. This mineral helps regulate heart function and vascular tone, but in excessive amounts it can cause over-relaxation of blood vessels, worsening hypotension symptoms such as dizziness, fainting, and weakness. A review published in 2014 in the journal Advances in Nutrition emphasized the role of potassium in regulating blood pressure and its impact on people with hypotension. The study pointed out that despite potassium's importance for cardiovascular health, its intake should be strictly controlled in people with low blood pressure to avoid side effects. This highlights the need to monitor sources of potassium in the diet, including avocados, especially for those who take blood pressure medications or frequently experience hypotension-related symptoms. Regulating intake under medical supervision can help stabilize blood pressure and prevent complications. Point 10. Nutrient malabsorption. Problems with nutrient absorption can worsen with excessive consumption of fatty foods, including avocado. A diet high in fat may hinder the absorption of certain minerals and water-soluble vitamins. Avocado, despite its nutritional value, contains a significant amount of fat, which can aggravate absorption issues. In particular, excessive fat intake can form complexes with calcium, magnesium, and other minerals, making them less bioavailable to the body. Additionally, large amounts of fat slow gastric emptying, which affects the overall rate of nutrient absorption. A study presented in the Encyclopedia of Food in 2016 examined the impact of fats on nutrient bioavailability. It stated that while fats can enhance the absorption of fat-soluble vitamins, they may also reduce the efficiency of absorption of other essential nutrients, especially in individuals with pre-existing digestive disorders. This study underscores the importance of moderation in fat consumption for those with malabsorption issues to avoid further deterioration of nutritional status. Point 11. Fiber sensitivity. People who are sensitive to high-fiber diets may experience discomfort such as bloating, gas, and abdominal pain when consuming fiber-rich foods like avocado. A detailed study published in 2020 in the journal Clinical and Translational Gastroenterology found that despite the overall benefits of dietary fiber, some individuals have a lower tolerance threshold. These people may react negatively to the 6.7 grams of fiber contained in a medium-sized avocado. This reaction is linked to the digestive system's reduced ability to effectively process large amounts of fiber. The study concludes that moderation or avoidance of high-fiber foods may be necessary to maintain comfort and normal digestive function in such individuals. Point 12. Anticoagulants. Taking blood-thinning medications such as warfarin requires careful dietary monitoring to maintain stable vitamin K levels, as fluctuations can affect the effectiveness and safety of the treatment. Avocados are rich in vitamin K, a nutrient that plays a key role in blood clotting. A sudden increase in vitamin K intake can reduce the effectiveness of warfarin and similar anticoagulants, potentially increasing the risk of blood clots. A study published in 2006 in the journal Expert Opinion on Drug Safety emphasizes the need for patients taking warfarin to maintain a stable level of vitamin K intake in order to avoid disrupting the therapeutic effect of the drug. This study highlights the importance of monitoring food choices that can significantly influence vitamin K levels, including avocado. Given this, patients taking blood thinners are advised to consult with a medical professional regarding their diet, particularly about how much avocado is safe to consume. Point 13. Chemical sensitivity. People with chemical sensitivity may find that avocado poses certain risks, especially due to the use of pesticides and chemicals during its cultivation. A study published in 2016 in the Journal of Food Protection confirmed the presence of pesticide residues in avocados. Although the thick peel of the avocado typically protects the pulp from pesticide exposure, people with heightened chemical sensitivity may still react even to trace amounts. Additionally, avocados are often treated with ethylene gas during the ripening process, a practice that may affect those with increased chemical sensitivity. Given these factors, it is particularly important for such individuals to consume organically grown avocados or to thoroughly wash them before consumption to minimize exposure to such substances. Point 14, drug interactions. Understanding the interactions between avocado and certain medications is crucial for effective health management. In particular, avocado is rich in monounsaturated fats, which can influence the absorption and effectiveness of various drugs. One critically important interaction is with cholesterol-lowering drugs such as statins. The high fat content in avocados may potentially increase the concentration of statins in the blood, enhancing both their effect and side effects. This interaction is important because it may increase the risk of muscle pain, a common side effect of statins, which in severe cases can lead to rhabdomyolysis, a serious condition involving muscle tissue breakdown. A study published in 2021 in the Europe PMC database investigated how dietary fats, including those from avocado, affect the pharmacokinetics of lipid-lowering drugs. The study emphasizes that consuming fatty foods while taking statins can alter the drug's absorption rate, potentially leading either to reduced therapeutic effect or an increased risk of adverse reactions. These findings underscore the importance of dietary monitoring and awareness of potential drug interactions. Patients on specific treatment regimens should discuss their diets with a doctor to ensure there are no unwanted interactions with foods such as avocado, which may affect the effectiveness or safety of therapy. Point 15. Latex allergy. People with a latex allergy may also experience a reaction to avocado due to a phenomenon known as latex fruit syndrome. This condition arises because some of the proteins in latex that trigger allergic reactions are structurally similar to proteins found in various fruits, including avocado. This similarity can cause the immune system of someone with a latex allergy to mistakenly recognize and react to these proteins in avocado. A major study published in 2018 in the Journal of Allergy and Clinical Immunology, in practice, examined this cross-reactivity and found that up to 50% of people with a latex allergy may experience allergic symptoms when consuming avocado and other similar fruits. Symptoms can range from mild itching or hives to more severe reactions such as anaphylaxis, underscoring the need for caution in individuals with a confirmed latex allergy. If you have any questions or something to say, leave a comment. You'll find more information on this topic via the links in the description under this video and on our channel.